Hi, good morning, everyone. Sorry for the wait. Thank you for taking some time out to join us in the Growing Minds Trauma, Anxiety, and Depression webinar this Saturday morning. This webinar is jointly organized by South West Community Development Council and Fong General Hospital under South West CDC's Family Bliss South West initiative. Today's session is the second out of the Growing Minds webinar series, which aims to equip parents and families with knowledge on children and youth mental issues. You will learn more about trauma, anxiety, and depression, specifically on how to differentiate depression and anxiety disorder from regular emotions, how trauma affects psychological well-being, and how to support your child through these mental health challenges. We have invited two subject experts from Fong General Hospital who will take you through today's webinar. Dr. Irene Titrajana, she obtained her basic and postgraduate medical degrees from NUS. Inclusive of her specialist training, she has 15 years of clinical experience in the mental health field, managing a broad range of patients with mental health conditions in various hospitals across Singapore. She is currently the head and senior consultant of the Department of Psychiatry and member of the Clinical Ethnic Committee at Fong General Hospital, as well as a clinical lecturer at NUS Yong Yu Ling School of Medicine. Her clinical interests include mind body medicine, mindfulness-based intervention, and trauma-informed mental health care. On to the next one, Ms. Jane Wong. Ms. Wong is a case manager officer in Fong General Hospital. She is a certified practitioner in therapeutic play and is passionate about child and adolescent mental health. After the sharing by our speakers, we will have a Q&A session at the end of the webinar. Dr. Irene and Ms. Jane will be selecting a few questions to address, so we encourage you to submit your questions using the Q&A function that you see on your screen. You may submit your questions throughout the entire duration of this webinar. We hope that you will find this webinar insightful and beneficial in your parenting journey. Without further ado, I will hand the time over to Dr. Irene. Dr. Irene, please.
Okay, thank you. So I'm just going to start first. Okay, where is the share screen? Okay, hi, so good morning, everyone. And I suppose most people here are parents. So I think I don't need to say how challenging it can be, this parenting journey. Yeah, and now, the topic of anxiety and depression, whether it is in children or adults or elderly, is a huge topic. Yeah. So just to set some expectations here, people take years to learn these things. So what I can capture here, what we can capture here, Jane and I, is just a small portion of it, right? And it is pretty much an introduction, also to basically invite questions later to clarify doubts, right? So that the Q&A session, I believe, is probably the most exciting part of talks like this. So I've done quite a few of these kind of things. So it is usually where the true learning happens, right? But bear in mind, because this is a public talk, we cannot give specific answers to specific cases. Right? So I cannot provide clinical answers. Okay, I can only speak in general, right? We'll see how that goes. Okay, so just going to, let's see, I can't remember what's the next slide already. Okay, so mentioned the first point already, raising a child can be very challenging. And no doubt, the past 2 years, it is like maybe 10 times more challenging, I think. Yeah, so that goes without question. Okay, so on the clinical side, we at the psychiatric department and also in consultation with our community partners and other allied health professionals in mental health, we are aware that a lot of people are under stress. Yeah, let's just put it that way. I mean, I'm sure you've been watching TV, you've read the news. The whole world is stressed. Rates of mental health disorders are increasing everywhere in the world, right? So it's not a secret, right? Now, consider this situation or compare it to like even 10 years ago, 15 years ago when I just started training and all that. It's a very different world. You know? Back then, people are even very reluctant to even say that they have any mental health issues. They are scared people will judge them, right? But these days, if you open the TV, you open the internet, everyone is talking about mental health. Yeah, so I think it's really, the world is changing. Yeah, and as parents, I suppose the challenge really is to see what we can do, the best we can do, the best we can in terms of supporting our children so that they can do their best in future, in the world in the future that we don't know what is going to be like. Okay, so it is a very challenging task. Yeah, so that's what I want to acknowledge first. Okay, now all children, without exception, would be sad, anxious, irritable, or even aggressive at times. Agree? Anybody disagree? Put out your hand. So, again, I think again that's just normal human nature. Yeah, emotions are normal human, a part of being human. Okay. Now, also for children, it's extremely normal for the behavior and emotions to change frequently and quickly. Yeah, it's just like that. That's just how the brain is functioning. And we can't expect children to be like adults. We can't even expect teenagers to be like adults, right? So now mental disorders, on the other hand, we do know that they can develop in childhood. On the other hand, because of the developmental changes that happen in childhood, it can be very difficult for parents or even sometimes for professionals, to figure out if does this child what does this child have? Do they even have a psychiatric issue? Okay, so that is a major challenge, and even within the profession, we are aware of it. Okay, so we'll talk about some of these factors later. Yeah, we'll see how. All right. Okay. Just prepared this slide. All right. Now this is my favorite child communication book. when I did my child psychiatry posting, the very experienced child psychologist there was the one who introduced us trainees to this book. Right. So I got a copy on my own and read it, and well, I don't have a kid on my own, all right? So but I still read it anyway. And it's been very useful in terms of talking to patients, both child and adults, actually. Yeah. And I just found this quote the other day, very amusing. Now, this lady is 94 years old, right? 90 plus years old. She was born in the 1920s, okay? She only wrote this book in the 1980s. So in her 50s, So that means probably after 20 years of being a parent and 20 years of being a trainer in child adult communication and parenting courses. Yeah, and then this is what it is. So communication. That's really a lot of the baseline is about that. Okay, and just to get it out of the way first, the boring slides. Okay, so this is the public service announcement. For younger children, these are the kind of things that we'll be looking at. Yeah, frequent temper tantrums, often talks about fears and worries. You can read it on your own, and you can find this list everywhere online, right? Now, we are also aware that for child psychiatry, actually for psychiatry in general, Singapore, but also worldwide, big shortage of psychiatrists. So waiting times and all that can be quite significant. If you get referred to see a child psychiatrist or to have your child see a child psychiatrist, the waiting time can be quite long. We are talking maybe about 6 months or more, right? So and a lot of the issues is just, a lot of it is very much everyday things. And often what parents want to know or would like to know is what can I do now? Okay. So the best thing you can do if you are in the queue and you just need to know what can I do now is join a parenting course. Okay, I think that's the best bang for your buck while you're waiting to get seen by the psychiatrist and all that. I'll talk more about these things towards the end of the presentation, right? Okay, now for child psychiatry, we use these three main diagnostic groupings. So in terms of psychiatric disorder, of course, there are many, hundreds of diagnoses. But for child psychiatry, we tend to divide into these three things, three big groupings, right? Externalizing, internalizing, and developmental disorders, right? So externalizing are things like conduct disorder, positional defiant disorder, attention deficit disorder, internalizing anxiety disorder, depression, obsessive compulsive. This is not an exhaustive list, yeah. So there are more things inside, but these are some of the things, especially from the middle group, internalizing disorder, which is we are going to cover today, right? So this talk is not going to cover the left and right side, okay? Just the middle one. Now, the understanding is that for internalizing disorder, yeah, on the right side, it is also known as emotional disorder. It arises out of the understanding that stress can be turned inwards. And the person affected or the child affected will be anxious, depressed, would probably have somatic symptoms, right? Now, not even say children, right? But most adults can probably recall a time at least once in their lives when they feel anxious. Okay, and if you remember how it feels, some of you would probably say, okay, my heart feels tight, my chest feels tight, or my heart is beating fast, or I feel dizzy, or my mouth is dry, or my stomach feels like you want to go to the toilet, right? Or my hands feel shaky, So all these things are some of the very, very common physical symptoms of stress. Okay, and I'll talk a lot more about this later because it's very, very important, especially if we are talking about mental health prevention. Yeah. Now, externalizing is the idea that stress, when someone is stressed, can be turned outwards. So think about, and I'm sure again, all of us here can recall at least one person in our lives who, when they get stressed or get upset, they shout, okay, or bang table, or slam the door, or throw things. Yeah, or even just be snippy or sarcastic or aggressive verbally, right? So that's externalizing behavior. Okay, in children, what we see is temper tantrums, right? Hitting the brother, hitting the sister, hitting the parent, throw toys. Okay, so that's externalizing. Now, this division is not very clear cut. So, for example, depression, although it is put under internalizing here, can also have as one of its symptoms, can also have irritable behavior. Yeah, so people, when they are irritable, they can externalize. Yeah, so that's one of the symptoms. Not everyone with depression has it, but it can be one of the symptoms. And then under externalizing, we have ADHD here, attention deficit, which by right should be under developmental. Yeah, but when we talk about child psychiatry, actually, the conversation came up yesterday. I can't remember with who now. But the kind of kids with ADHD that got discovered, that means got diagnosed, got sent to a psychiatrist by the parent or by the teacher, right, are those who externalize. So they tend to be hyperactive, they run around, they fight with the schoolmates, they shout at the teacher, all right? These are the kids with ADHD that got sent to see a psychiatrist early in life, okay? But there is also a subtype of ADHD with more internal symptoms. So their distraction is internal. You don't see it from the outside. They're just a bit lost in the clouds, like in La La Land kind of thing, right? So this type tend not to be discovered within the school system. Okay, externalizing, internalizing, all right. Now, the average age of onset in children. So there are many, many different types of disorder. This one is about anxiety. Yeah? I'm talking about anxiety now. Tend to occur at different ages. Yeah, so things like animal phobia tends to start occurring around 6 or 7, separation anxiety 7 or 8. Can be earlier as well. So these are just estimates. It can happen at a slightly different age. Okay, so let's see. Now, I'll talk a little bit about the difference between anxiety and fear, right? Yeah, well, I can talk about 1 hour just about emotions. so, so fear is an unpleasant emotion, which is caused by being aware of danger, right? Is it unpleasant? Yes. Is the fear itself dangerous? No. Yeah, so there is a difference there. The feeling is unpleasant, and often it is very physical. Yeah, can be cold sweat, can be shaking, heart beating fast. So it is unpleasant. But those sensations alone are not dangerous. It's a normal part of human life. Okay. I don't know if I'm sure everyone is afraid of something, right? Okay. So think about maybe if you are afraid of animals or exams or presentations, and the kind of feeling you have in the body. Yeah. So it is unpleasant, but those sensations itself are not medically dangerous. Okay. It's a important concept to understand. Now, anxiety actually is fairly similar to fear and often is used interchangeably. But our concept and understanding about it is morphing. Yeah, over time it's morphing. So it is not very consistently separated. Right, I admit that. Yeah, but it is more like a long-term apprehension. There is an element of a longer term, and it is a reaction to some anticipated outcome in the future. So it's something about the future that is producing this kind of feelings or emotions. Okay. Now, it's while fear is one of the core emotions. So core emotions is this idea, this concept, where the emotion is an important part of survival. So really, all human beings, all human races, when people study different ethnic groups all over the world, people who've never had contact with each other, they all have similar of these 6 to 8 types of emotions that are present everywhere in the world for every human being. Okay, so that's just to illustrate how normal it is. It is actually hardwired, right? It's actually hardwired, and it's really a very important component for survival, right? But anxiety is not. Okay, so there are groups of people often in those very very small tribes who never contact modern society. They don't understand anxiety. Okay, so that's the difference, right? So anxiety may not be present, yeah, because I think it's the modern lifestyle, right? So fear is really, there is an objective external danger, yeah, or perception of danger. Yeah, the object may not be really that dangerous, but to the person affected, it is dangerous. Yeah, so there is that perception of danger. The object is there, right in front of you, threatening you, right? It's imminent. It's right there, and it produces this fight or flight response. I'm sure you have heard of it. The hormone is called adrenaline. Yeah? So when people say they get an adrenaline kick, this is the fight or flight response. And what's the effect of adrenaline? The things I mentioned earlier: heartbeat going fast, cold sweat, muscle tension, all these things. It's short-lived. If you let it be, you may shake or whatever. A few minutes, okay. All right, it's okay. It's normal. Yeah. Okay. Now, anxiety is different. Now, anxiety, there is no end to it. You can be anxious about anything, including something that is not even that dangerous. Yeah. And there is that element of uncertainty. So it's that element of uncertainty that brings to it the limitless potential of danger. Okay. So there is a lot of cognitive component. There is a lot of thinking process going on. Okay. Whereas fear is very reflexive in that sense. Yeah. Okay, so these are some of the symptoms. Now, the same kind of thing also happens in fear. Yeah, the difference is in how that fear is created, is produced, and how it actually comes up and comes down quite fast. Yeah. So whereas this one can go on and on and on. Right? So yeah. Okay, so there is many more than probably 2 dozen symptoms, physical symptoms. And these are the kind of things that when people are not aware of it, they don't understand their own bodies, their own reactions to stress or to fear or anxiety, make people think that they have a medical condition when they actually don't, right? So these are the things. Okay, so components of anxiety I mentioned earlier, emotion. Yeah, so the emotion is dread, that kind of pressure. It's a kind of pressure or tightening, right? Worry, tension, apprehension. The cognition, very important component, is what's going on inside our mind. Now, I do mindfulness, so sorry if I talk like this. It's a bit different from how normally psychiatrists talk, right? So in mindfulness, we become a lot more aware of what is happening to ourselves, right? Whether it is in our mind or in our body, all right? So and I have to mention this because a lot of people are not aware. A lot of people are not aware of what's going on in their own minds. Yeah, so their own thought process. So and I see this a lot. Yeah, almost all the time. And it's more common for younger people, but even adults is quite common, right? The content is can be a verbal thought. It's like a voice in your head, but it's your own mind, it's your own thinking, not voice as in hearing voices, okay. So but it can come up like a sentence, like, okay, for example, before giving presentation, oh no, maybe they won't understand what I'm saying, okay, or oh no, maybe people will ask difficult questions, okay. So those are examples of thought content. Before exam, oh no, I won't be able to finish the paper, yeah, or any kind of thing. Before a party, oh no, maybe there is no one I can talk to, or people will look funny at me, So these are thought content, can be verbal, like a sentence in your mind, or a voice, your own voice in your mind, or it can be visual. Some people are visual thinkers, so they almost never, right? So these are the contents of mind. Yeah. Okay. Now the thought process itself can be disrupted when people are anxious. So people can report, for example, they can tell us too many thoughts, cannot catch the thought. It's like cannot follow the thoughts, too many, right? Or the opposite, it goes blank. Yeah, I think people with kids who are anxious about exam probably might have heard this. My mind goes blank during exams. Very common, right? Okay, physical, mentioned already earlier, but many, right? And the interesting thing is that there is a typical group of symptoms that occur for everyone. So your signature of fear or anxiety will be different from mine, will be different from Jane's, will be different from Esther, right? Everyone is different. Okay, so figure out your own reaction, your own signature, right? Okay, so now what parents can do, especially when the fear and anxiety is of a normal level, the kind of fears and anxieties that all human beings have, all kids in the modern age will have, right? Is to normalize and validate. Okay, what is normalize? Normalize is to tell them, okay, it is normal to feel this way. Yeah, and I think most parents do this. Most parents do this already. I don't need to tell. I don't need to say. Yeah. The common one I've heard from parents is that, yeah, I told my kid already, don't worry about it, right? Don't worry about it. So that's, but that's a bit different from normalizing. Yeah, normalizing is more like, yeah, everyone has this. Yeah, everyone can experience this thing in their lives. Mommy has had it also sometime, daddy has had it sometime, so your koko or your cheche also have it sometime, right? So it is normalizing, right? Validating is, okay, another common one I hear is that parents might tell their kids this, for example, if let's say the kid is scared of something, right? Scared of dog or cat, for example, the parent might say, "Ayah, don't be scared lah. It's okay, very cute, but it's not scary, right?" Okay, so they're not scary, right? Okay, is invalidating. All right, the kid is scared. Okay, the kid finds the thing scary. All right, if you say it's not scary, it is invalidating. Okay, so very minor thing, and I think most people will have done it at least once, right? But it does happen. Yeah, so just something to think about. Okay, second one, very interesting, model coping skills. Okay, so coping skills, everything from relaxation exercise, calming exercises, grounding, from skillful behavior, right? Problem solving. So all these things, there are many of it. And it is good to master a range of it, not just to rely on one. Okay. And on some extent, distraction, which is one of the very common coping skill. If you feel sad, go and do something else, right? Okay. And everyone does it to some extent. But we cannot, it is useful, it is effective a lot of the time, but that cannot be our only coping skill. We have to develop other skills as well, right? Okay, third one is very interesting. Understand your own personal fears. Yeah, so if you don't understand yourself, it's very hard to understand your kid. Yeah, so that's the thing. Now, fourth one also very interesting, and it is the challenge of modern lifestyle, the current age we live in, right? Outside influences. What outside influences we are talking? I'm talking about news. I'm talking about social media. All right, people are affected by what they see or hear. Okay, if we think about, just now I mentioned some tribe somewhere never contact modern lifestyle, right? They don't have internet. Okay, to them, life is only about what is in front of them at this point. Okay, like just their family, their tribe, the village. Yeah, but now we are getting news and exposure about all the calamities in the world that is affecting 7 billion people. Okay, 7 billion people. At any second, hundreds of people die in the world. It's a fact. Okay, so it's a fact of life. With 7 billion people, that's what's going to happen. Okay, and the human mind, the human brain is not calibrated to cope with this level of information. Okay, and sometimes we wonder why there are so much increase in child and adolescent mental health issues. This is one of the reasons. Yeah, so outside influences, too many of it, too much of it. Yeah, so as parents, I think it is good to be mindful of this and to know when to limit exposure to such things. Right? Now, the last one, just to not be too confusing about it, by increasing exposure, I'm talking about the present issue. Yeah, so let's say the child is scared of exams or scared of dogs or scared of something. Gradual exposure to the challenging situation is what's going to cure them. Yeah. But gradual. The emphasis is on gradual, right? Okay. Next one. What maintains anxiety? All right. So for children, of course, very often is lack of coping skills. They don't know. Yeah. As children, they haven't learned about it. So it's simply not knowing. And cognitive errors, very common. This one, children, adult also have it. Everyone has it. Yeah. But this is what makes the anxiety continue, basically. Right? Okay. Parent factors, encouraging avoidance too much. A little bit is okay and very useful sometimes, but too much is and if that's the only skill the child learns, then that's not going to be helpful for them in future. Yeah? Excessive reassuring. In a sense, it's a bit like avoidance as well, but you become the provider of it. Okay, so by reassuring the child, yeah. But what you would want is to help the child to develop their own skills, right? And offer protectiveness. Okay, what conditions that mimic anxiety? Too much caffeine. So that's the physical sensations of drinking too much coffee is the same as sensations of fear or anxiety. The first thing I do when people come to my clinic having panic attacks or anxiety issues is to find out, one of the first things is to find out how much coffee they're drinking and to let them know to reduce that, or not to take coffee at all sometimes. So coffee, tea, also Coca-Cola also, so these three things all contain caffeine. Chocolate as well, if you eat a lot, there is a bit of caffeine in there, and some people are super sensitive to it. Okay, sleep deprivation can induce or worsen anxiety. Stimulants, drugs, and alcohol withdrawal. Some medicine also actually. Okay, so those are the so-called normal kind of anxieties, fears, and all that. Now we are moving on to the actual psychiatric conditions. Okay, so what marks something to be pathological? And pathological means it is abnormal. It is part of an illness, right? Is when it is too out of proportion to the risk of and severity of the stimulus, and it causes problems. Basically, it causes issues. It interferes with social activity, studies, or physical aspects, right? Just to give an illustration, I think it's important to understand this point, this concept. Huh? Okay, just now I mentioned exam anxiety, right? I think most of us can remember a time when we have exams and feel worried about it, or feel anxious about it. Okay, so we have our baseline of what is normal. We understand that it is normal to feel anxious before exams, to some extent, all right? But when it is too much, and by too much, until the person cannot go for the exam, for example, yeah, so don't even turn up, or worse, don't even go to school, right? So now that becomes a problem, yeah. So that is the level of interference we can talk about. Or when it is too much until the mind is so busy or so blank until the child cannot even study. Although there's plenty of time for them to study, but they cannot because they are too anxious, like months earlier, you know. So that interferes as well. Yeah. Of course, if they have months to study, but they feel anxious for 1 or 2 days, then they cannot study for 1 or 2 days. That's fine, lah. You know, that's a matter of proportion, right? Okay, and avoidance. Yeah, so avoidance means let's say they don't go to school, right? So that kind of thing. Okay, causes of anxiety disorder. This one is a favorite question, almost get asked every time I give talks like this, right? The answer is it is a complex thing. It's not a one thing or the other. Yeah, there is no single gene we can pull out. By the way, human genetics or mammalian genetics, the higher animals, is a very, very complex thing. Yeah, it's very rare to be able to pull out one single reason, yeah, one single gene like that. Even think about something like diabetes, for example, right? Very, very common illness. A lot of people have it. There isn't a single gene that predetermines that someone might have diabetes. Yeah, so it's a bit like that. Because it's a very common question. People say, oh, if I have this problem, will my child have it? No, it's not a guarantee. It's not a guarantee. Yeah? But it is a risk factor. It's a risk factor, right? So that's the thing. But there are also components that actually comes from the environment, right? It comes from the environment. A lot of behavior is learned. A lot of behavior is learned. So sometimes if the child sees people around them are very fearful of things, they might pick it up. Okay? If the child sees people around them are very anxious about things, they might pick it up. Yeah, so that happens. Yeah. If the child sees other people around them are violent or aggressive, they can pick it up. And this has been shown in behavioral experiments, psychological experiments. There is a famous one. You can search on YouTube later. It's quite interesting and really watch the video. You know, it's a short one, like 3-5 minutes like that. Yeah, called Bandura, Bandura. Yeah, the Bandura is a very long time ago, done by a psychologist. Yeah, and that shows the effect of modeling behavior, how children learn from adults. Okay. And quite scary lah, actually. Okay, so now psychoanalytic theory, actually I shouldn't call it psychoanalytic. Yeah? It's basically is the idea that a lot of anxieties come from the mind, from the processing of information in the mind, right? And this processing of information, earlier I talked about things like cognitive distortions, right? Like error in thinking, basically. It's something that happens internally. Yeah, and when people go for psychological therapy, different types of psychological therapy, one of the things that the therapist would do is to actually first bring it out to consciousness. A lot of people are not aware of it. I mentioned, yeah, a lot of people are not aware of the working of the mind. So bring it to consciousness first, and then try to correct it in some ways, or try to resolve the tension in some ways, right? So that's the psychological theory. Don't do it yourself at home. I know some people like to, okay, just learn from 1 page or 2 page and try to apply at home. So yeah, it's not an easy thing to do, especially not with your own child, with your own children. Yeah, too many complications there. Yeah. So yeah. So remember what I mentioned earlier about invalidating. If you tell your child, oh, you are thinking wrong. You're thinking wrong. Your thought is mistaken. You got faulty thinking. Okay, that's not very helpful either. Yeah. So yeah. Okay. Types of anxiety disorders. These are the common ones. There are many others. Yeah. So some common ones. I put star here because these are used to be under anxiety, but in the old classification system, but it has been taken up. Now it's got its own chapter, you know. Yeah. But used to be, so I'll include some of them. Okay, specific phobias, very, very, very common. Lots of people, I think left, right, center are afraid of cockroach, right? Animal type. And this kind of fear can start very early in life, right? Natural environment, fall. Okay, this picture here is from a psychological study. This is called a visual cliff, right? Don't worry, the child won't fall. It's actually a table with plexiglass. Yeah, but it looks like like a drop. Yeah, is to test at what age babies start to have the fear of falling. Okay, so apparently it only started when they start crawling. Yeah. So before crawling, no. So the idea is that the fear only develops after they know the consequence of falling. Yeah. Okay, but some are almost hardwired in a sense. Fear of the dark, fear of lightning, bad weather, that can, and loud noises. Yeah. So it's almost like hardwired in a sense. Doesn't mean that it cannot get better. But the arising of it, the how it starts, can be very natural in a sense. Yeah. Okay. And the age, the common age where it can start for children. Okay. So 6 to 24 months, fear of separation from the parent. Again, very natural. It's a very natural thing. So when a child cries when you leave, when a child of this age cries when you leave them, it's because they're afraid. And yeah. Loud noises, strangers, falls, and then later fear of animals, monsters, the dark, bad weather, right? Accident. Then later on, only the older children start to be afraid of things like death, accidents, school failure, kidnapping, and social fears, embarrassment, failure, that kind of thing, right? Okay. So fear can be very, very natural, all right? But it can also be produced by something that happens to the child. So this is where the so-called trauma thing comes in. Okay, although saying that, I have to be very careful and very clear here that by trauma, it doesn't always mean, okay, there are two ways to talk about it, right? So there are, when we talk about PTSD, for example, post-traumatic stress disorder, we are talking about major trauma. Yeah, so major trauma, and later I provide the definitions. Most people, thankfully, in their whole lives, never experience those things, right? So those are uncommon. It's uncommon. But a lot of people might have had minor traumas, right? Yeah. So and I show you some of it, and it can produce fear reaction as well, in a sense, right? This was an experiment about 100 years ago, done about 100 years ago. Nowadays, you cannot do this kind of experiment anymore. Yeah, it's unethical. Essentially, what the experimenters do is to create a phobia. They produce a phobia in a child on purpose. Okay, so the child was normal before that. They documented that with pictures, videos. The child was not afraid of these objects. Soft toys, furry animals, the child was not afraid, right? And then they produce fear through classical, using classical conditioning. So what they do is they will show the child a soft toy, and then they'll make loud noises by banging some metal together. You know? So every time the child sees a soft toy, they'll bang some metal to make the child cry and make the child scared. All right. So unethical. This one definitely cannot do. Right. After a while, just the sight, just seeing the soft toy itself, cause the child to cry. The child becomes very afraid, not for the sound itself, but for the soft toy now. Okay, so that's classical conditioning, right? And after that, it spreads up. Not just scared of soft toy anymore, but also scared of furry animals and scared of anything fluffy like that. Yeah. So Santa Claus. This one is a guy wearing Santa Claus costume, and the child is actually afraid of him, right? Okay, so very poor kid, but yeah. So it is cannot do this kind of thing. But it does show us that this kind of fear can be produced, can be created, basically. Okay, panic disorder, very common. Panic attacks. This one maybe for older kids. Small kids, usually they can't really explain it in that way, or they don't experience it. The panic attack itself is very short and sudden. It's like a spike of fear. Sometimes with a clear cause, sometimes without. So depends on what it is. The common one is the panic attack occurs when people are in crowded places. We call it agoraphobia, a place where it is hard for them to escape from. Okay, so MRT station, supermarket, all these things, very common. And panic attack happens, and through this process of classical conditioning, remember, a panic attack is very unpleasant. It's a very unpleasant stimulus. The panic attack happened in a specific place several times, and then after that, the person will be afraid of that place, even without the panic attack. Okay, you can see the connection, the parallel there. So it is through classical conditioning. Then people start to develop fear of this specific situation or specific object. Sometimes, same thing with the phobia of animals, for example, or phobia of certain things, right? Maybe they get this fear reaction several times through this exposure. And after that, even without the fear, without the exposure, the fear is still there. Yeah. So, okay. So panic disorder is like that. In between, though, the person is completely okay. Yeah. Sometimes they may be anxious whether they are going to have a panic attack again. And that is, the anxiety is the part that is quite disabling sometimes. And sometimes they develop a fear of certain things that make them worry that they might get a panic attack there. So like the fear of the crowded places, all these things. Yeah. Okay, so this is the panic cycle, we call it. There is the, okay, let's start here. Yeah, let's start at the bottom, bodily sensation of fear. So mentioned before, it is unpleasant. It's unpleasant. And when it happened for the first time, panic attack, I'm talking about panic attack. When it happens for the first time, a lot of adults end up in hospital because they think they have a heart attack or they have a stroke, right? So it's a very scary, unpleasant sensation. Or they think they're going to collapse, right? So there is a misinterpretation of this sensation of fear. Yeah, so they thought it's something very, very dangerous. There is the perceived threat. And then, but the level of anxiety, apprehension, anxiety, because they are scared it might happen again, actually produce more physical sensation. So it's like a vicious circle. Yeah, it gets worse and worse within that short span of time. Okay. Yeah, so this is what I mentioned earlier, fear of crowded places or fear where they cannot escape. Okay, now we move on to social anxiety disorder. It's anxiety related to social situations. Yeah, can be talking in public, speaking in public, eating, performing, talking to strangers, right? Another common one. Yeah. So the physical symptoms are quite typical. Often the person might be shaking or feeling the heart is beating fast or feeling they're stammering. Yeah. So Now, generalized anxiety is when there is persistent. It's got to be at least 6 months or so, very, very long term. Excessive. The person themselves can tell that I'm thinking too much. This one is usually in older kids, this is in older kids and adults, not very young kids, right? So they have a better understanding about their own feelings and mind, so they can tell you it is too much. I don't know why I worry about this thing, but I'm worried, right? The physical symptoms can be things like muscle tension, headaches, fatigue, feeling weak, feeling tired because the muscle is always tense. And mental symptoms can be difficulty concentrating. They can also be quite irritable sometimes, can get upset easily sometimes. Yeah? Insomnia is quite common, cannot fall asleep and all that. The worry is about minor everyday things. Things like about health, think about safety. If mom comes late to fetch you, you feel like, oh, is she in an accident? That kind of thing. School, oh no, is this teacher angry with me? Is this friend angry with me? Right? If at work, oh no, is my boss upset with me? Right? So that kind of thing. Yeah, so very, very common stuff. It is what is called free-floating anxiety. So it can be anything. The anxiety is just there. It can latch on to anything. Yeah. And often it's about the future. This is the kind where I say there is no limit to it. Everything also you can be worried about, right? Okay. Okay. We are moving on to the things like post-traumatic stress, right? This is very specific. Yeah. I mentioned earlier the primary thing is that a major trauma has happened, right? So what counts as major trauma? It's something that threatens your life or limb. Okay, that's the short definition. So let's say being in an accident, major accident, being in an airplane crash, obviously, right? Yeah. So now what we are seeing now with COVID and all that is that sometimes just going to ICU, for example, or even being in ICU, of course, it is life-threatening, right? So it can produce PTSD-like symptoms, right? So that's kind of thing. But in the past, we are talking about things like accidents, basically. Accidents, assault, being beaten up so bad, that kind of thing. Okay, because this one is about child and parenting, right? Now, children develop at different rates. Okay, so children develop at different rates. At some point in life when they are young enough, they may not understand a parent's anger. Yeah, so I'm saying this not to tell parents cannot get angry at your kid, okay, because that's impossible. It's impossible not to be angry sometimes, right? But for a very young child, the level of anger, if it is too much, can feel life-threatening, right? So just to mention that. Okay, so it's got to be in proportion. Yeah, it's got to be in proportion. Also for children, the symptoms of post-traumatic stress is not like adults. They cannot tell you, they cannot describe to you. What sometimes happens is that they might play act. They might actually stop the things that are distressing to them, the things that they find quite traumatic, right? So that's the thing. The other symptoms would be stuff like being very, very fearful, avoiding the things that they think might produce this kind of danger, anger, changes in appetite, changes in sleep pattern. Okay, and it's got to last for quite a long time, at least more than a month. Okay, we are moving on to OCD, obsessive compulsive disorder. It comes from two components, obsession here and compulsion here. Okay, so obsession is a mental process. It is a kind of thought. It's a kind of thought that just comes up by itself. Actually, if we pay attention to our own mind, a lot of thoughts just come up by themselves. It's just automatic come up. So for obsession, however, it comes up a lot, and it's almost always the same thing. Yeah. Now, what's different from obsession and the kind of thoughts that keep coming up when someone is anxious, for example, is this thing called ego dystonia. Okay, so what this means is that if someone is anxious, let's say about exam, right? And every day the thoughts keep coming up. Oh no, how about my exam? Oh no, I cannot study. Oh no, I'm going to fail this exam, right? That is ego syntonic. Yeah, they themselves understand why they're having this thought. If you ask them, why are you worried about exam? Yeah, because it's very natural for them to think, yeah, this is me. I am anxious, and I can see that I'm anxious about exam, and there is a reason for it. But for obsessions, the thoughts do not make sense to the person themselves. Okay, so one example is later I give some example, yeah, because some are quite bizarre sometimes, right? So the thoughts themselves can be quite strange. Okay, although I have to say for kids, for children, it can still be ego syntonic. So children are different, yeah. So they don't understand what makes sense, what doesn't make sense, right? So they might not be able to tell you that, right? So usually for children, we see or judge it more from the behavior. Okay. Now behavior compulsions, it is usually a physical action. It's a physical action. So things like checking, washing hands. I think most people know about washing hands, yeah. But checking also quite common. Locking the door repeatedly, like click, 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 yeah, right? And having rituals. So a ritual is when someone needs to do a certain process in a step-by-step way, not because they have to, like in hospital, when you wash hands before surgery, you have to follow the steps, right? Not like that, right? But it's although they don't have to, they design their own process and they have to follow it like that. Have to be like that. Like for example, bathing, yeah, have to start from this part first, then that part, that part, that part. Now, to some extent, a lot of people do that, but for people with OCD, if they miss a step, something doesn't feel right. So they have to repeat the whole thing again. So as a result, people can keep doing it and doing it and doing it. I think one of the worst cases of OCD, right, I've encountered, can spend 10 hours bathing a day. So every day spend 10 hours in the bathroom just bathing, right? So it can be that the whole process can start from like cleaning the bathroom itself, scrubbing the bathroom, and then washing different parts of the body, how many times each one, right? Using soap, must press the pump how many times. Okay, so must count, so many variation, but they have to follow a lot of steps, right? So that's what happens sometimes. Now, not all OCDs are that severe. That's on the extreme end. Yeah, a lot of people have mild OCD actually. Yeah, so that if it doesn't cause much disturbance in life. Okay, compulsion. So that's compulsion, can be cleaning, checking, counting, right? Can also be mental. Yeah, so repeating things internally. So it can, for example, be counting in your mind or repeating a certain phrase in your mind, right? Stuff like that. Obsession can be a fairly normal one, like fear of germs, right? Very common. Then result in hand washing, right? But can also a bit more bizarre. This one is less common. But what I would like to mention, because this might affect parents at some point, mothers especially, and this sometimes happens after people have a baby, maybe even the first or second one or whatever. Some, if they do develop OCD symptoms around this time, it can be something as scary or as bizarre as killing the baby. All right. So and it's very scary for can happen to the fathers as well. Yeah. So both males and females can be affected. Yeah. But it's very bizarre. In a sense that they themselves know it's not that they want to do it. Yeah. Under normal circumstances, no parents would. Right. So they know for sure they don't want to do it. They are not going to do it. They have no intention of doing it, but the thought comes up. So that's very scary. Okay. But the thing about OCD is that it will not happen. Yeah. So that thought of them doing it will not happen. Right. So So usually when they come to my clinic and it is clearly OCD, a lot of the work is to reassure the parent that yeah, this is a scary thought, right? But you know very well you're not going to do it. Yeah, it's just a thought. It's the thought cropping up that's not normal. It doesn't going to happen. The thought itself cannot do anything. Yeah. So that's the idea, that the thought can come up by itself, but the thought itself is, the thought itself won't do anything in the world. Yeah. It can't cause things to happen unless you want to do it, right? So there is a huge difference there. Okay, what else? Much overlap. All right, so a bit of a summary or conclusion for this part. There is a lot of overlap between the various anxiety disorders. Having one puts you at risk to have another anxiety disorder, right? It doesn't mean that the condition is worse in a way. Yeah, so if you think about it on the flip side, that means you treat one, you also treat the other one. Okay, so if you look at the bright side, you treat one, you treat the other one, really. All right, so because sometimes patients get very distressed, they get very upset when they know, oh, it's this one plus that one. Yeah, but to us, it's the same. It's the same form of treatment. It's the same form of yeah. So the treatment itself is good for all the conditions, right? So okay, but sometimes people might have an additional mood disorder. So got anxiety and depression, right? For example. Okay, so worldwide, different from country to country, in Western populations, about 5 to 6%, the overall anxiety disorders. Okay, so that's anxiety. I'll move on to depression quickly. I think time is a bit short, but so depressed mood for more than 2 weeks, very much reduced interest or pleasure, weight loss or weight gain, sleep too much or too little, right? Psychomotor agitation, retardation, feeling tired all the time, no energy all the time. Yeah? Not sometimes we all do. Feeling worthless, feeling guilt inappropriately, cannot concentrate, cannot decide, right? And recurrent suicidal ideas. Not everyone have all the symptoms, only need 5 or 6, right? So some have all, some don't. Okay, so that's some of it. Now, depression also can have physical symptoms. Yeah. So some do get pain here, pain there, right? More common in the elderly also. So and mood symptoms is very common. It is a mood disorder, right? Okay. Now, general coping strategies. Yeah, general coping strategies. Sleep, food, exercise goes for everyone. This is sleep, food, exercise. It's just life necessities, right? Connection with family, friends, nature, right? Strength-based approach. Now, very common, especially when kids have a mental health issue, or for many, right? The focus is on what's wrong. Okay, so the focus in what's wrong or what you shouldn't be doing, right? What about we flip that? We switch that to see what are you good at? Yeah, what are you good at, and what you should be doing instead, right? For kids, for example, right? Not too packed with activities. Give them a bit of breather, yeah, a bit of downtime, unstructured activities, play, just let the kids be kids, basically. Okay, and for parents, very important. This one is catch your breath. When you find you're getting frustrated with your child, stop. Okay, catch your breath for a few moments. A pause there, right? Think before you respond. Plan before you respond, right? Accepting negative feelings. Now, this one, accept negative feelings, not just in your child, but in yourself as well. Okay, now I see mostly adult psychiatry, right? Adult psychiatry patients, and I see a lot of parents. Okay, so it's quite common for parents to feel bad about being angry to their child, right? Or to feel bad about some parents might feel like it's very difficult to be a parent, right? Feel very upset about it, and they feel bad about it. So the feeling bad doubles up. Yeah, there is that feeling itself, right? Feeling angry or feeling upset or feeling disappointed with your child, right? And then there is another feeling on top of it. Yeah, so you double it up yourself by feeling bad about this one. Okay, you can see that. Yeah, but what happens? What happens if you are aware of this process? You know you got a bad feeling there, and you don't respond with another bad feeling. You just let it be, right? So while this one actually refers to interaction with your child, so let's say your child is angry with you, right? Say I hate you, you know, I don't like you, whatever. You always like TT more than me, you know. You don't respond to the anger with anger, right? Or shout back at the child, right? So you wait, let it be, let it just be there. Yeah. So okay, I see. Yeah. So some reflective statements can help. Okay, I can see that you're very upset with me or with your brother. Yeah. Okay, then after the child calms down, you can ask them to tell you more about it. What's the reason behind it, right? So just giving it space, giving them space to calm down. If they need help, you can help them do it, right? Help them, remind them about the counting. Everyone teach the kid to learn how to count, right? To calm down, right? Count to 10. Breathe slowly, right? Yeah, so that kind of thing. Okay, labeling emotions, very important skill. Yeah, so reminding the child, they would have learned something already, but sometimes when they're upset, like ourselves also, yeah, sometimes when we're upset, we cannot recognize our own reaction, we cannot recognize our own emotions. So as the adult there, you can help the child to label their emotions so that they learn from it. Yeah. Okay, and model coping skills. Yeah, children learn from what they see. Okay, historical. Okay, I don't know if I have time for this. It's just some historical stuff. Just to have some idea that you know, childhood was really a very difficult time for across history. All right, across history, they are treated like adults sometimes. They are treated like a servant sometimes, right? In some societies, parents have full right of their children. That means they can actually even kill their child if they want to, and they're not at fault, right? So it can be like that. It's only in the 1800s then things start to change. Okay, so some pictures from the 18th century, how children actually work and all that. This one is a slave girl. Yeah, you can tell because she's not wearing shoes. Okay. And children get sent away from home, from their parents. Britain used to do that a lot. The UK used to do that a lot. Sends thousands of children to America, that time when still their colony. So in the 1700, children got sent there to be indentured servants. So like slaves, basically, or to be apprenticed, yeah, without their parents. Often these are orphans also. Even until 1970s, kids are still sent to like Australia and all that. Okay, so just something to just a reminder. Children often don't listen to you, but they look at you, they watch you. So, okay. Okay, some risk factors. Okay, now sometimes when people read this list, they get anxious. Yeah, as parents, they get anxious, and do know that some of it cannot be helped. Some of it are beyond our control. People dying, for example, is beyond our control, right? So there are things that's beyond our control, but there are also things that within under our control. Yeah. So the caregiving can always be improved at some point, and children have that capacity to change. They have a lot of capacity to grow, to get better, right? So if after this presentation you feel, oh no, I did this to my child, you know, I shouldn't have done this, I shouldn't have that. Just know now is the time to change if you want to, right? So it's never too late, right? Okay. And I want to talk a little bit about attachment theory, but I don't think I have time. I have enough time, all right? So, but secure attachment. We want to develop secure attachment. By the way, yesterday or 2 days ago, there was an article in the Straits Times about physical punishment. Yeah, I think NUS and Children's Society did a study, right? Surveying like a few hundred parents, right? And half of them admitted that in the last year they have used a physical method to correct their child. Yeah, so either hitting with bare hand or with an object. Half, right? So it is very common. It's how what's considered normal in society, right? But we do know also there are some possible negative effect from it, right? So I think there is a move worldwide, Singapore definitely part of it, to help parents to learn other ways of disciplining their child, more gentle ways, right? To not always use force. I think one of the professors who got involved in this study actually said something very interesting and very important. I felt that using force is only useful to stop the behavior immediately, but you take away from the child the opportunity to learn, right? So I think I'm rephrasing, yeah, but I think that's a very important component, right? So we want children to learn from their mistakes. Okay, so secure attachment and for discipline and punishment or reward to work well, kids need secure attachment. Okay, and it starts very early in life, in childhood, but it can also be improved later. Right? Okay, so some ideas. This one will take too long to explain, but can read up a lot of research around this area. Okay, just going the last two slides, and I'm finishing. This one is what we call Maslow's hierarchy of needs. Yeah, so it's the idea that we have different needs in different areas, from physiological, safety, love, belonging, esteem, self-actualization, right? So we need to work on these components as well, right? And it takes a village to raise a child, right? Just to be funny, I put a picture here of a stack of the textbook that we use to diagnose, right? It's called DSM, Diagnostic and Statistical Manual. So are we just going to label everything or throw everything to psychiatrists and just leave the kid to get a psychiatric diagnosis? Or we want to start here? We want to start here with self-care. Yes, take care of ourselves first. Self-care for the parents. Yeah? Parents' self-care is very, very important. So always look out for yourself first, right? Then only you can be more effective at helping your child, right? So that's a very important concept. And then, of course, we rely a lot on our community partners. Yeah, that's including the people who organize this talk, for example, and very well done. Yeah. So this is how this thing works. You know, specialist is only at the last bit. So and there are not many. So it starts here. Yeah? The care starts here. Okay. Yeah. This is a quote from a very famous poem from Khalil Gibran. Yeah. Lebanese poet. Yeah. From Middle Eastern Christian poet actually, but his poem is influenced by a lot of the different religions. And I think even if you're not religious or you belong to any other religion, it still rings a bell. The idea that we are here to help, to care, right? We are here, but we don't force them to conform to, what we want in that sense, because they are preparing for the future, right? Okay, Ken, so I'll stop here.
Thank you, Dr. Irene. I'll move on with the slide. Yeah. Yeah. Okay, everyone can see my slide. Okay. Yeah, thank you, Dr. Irene, for the insightful sharing. I thought I would just continue with this talk to talk a bit more about supporting children and youth mental health. And not sure whether anyone attended the previous workshop. It's a bit quite related as well. So the next, maybe can talk about how we can build resilience. Like what Dr. Irene mentioned earlier, there are a lot of risk factors, and sometimes we can't really stop it from happening. And so instead of putting emphasis on perfection and performance, we can actually focus on helping the children learn to how to bounce back from failure. Like resilience is our ability to adapt and bounce back when things didn't go as planned. And resilience is a muscle that we can help the children to build on it. And they build resilience over time through experience. Every kids face challenges, right? They have some stumbles. It's actually part of the growing up process, like not getting the school they wanted, fall out from a friendship, losing a big game, failing a test, getting bullied, or even harder, severe hardship. Yeah, and sometimes we just feel so helpless that it's impossible to solve all these problems for them. So it's important for the kids to know that they actually have help. We are here to help them. The parents are still with them, working alongside and listening. We can help them to learn skills and to build on resilience by having a warm, supportive relationship with them, just like secure attachment. Yeah, so when things don't go well and children feel anxious, sad, disappointed, afraid, resilience helps them to understand that this uncomfortable feeling but usually don't last forever. Yeah, so we can also talk openly about memories that we share with them, not just the positive one, but also the difficult one. So it can help the kids to make sense of their past, also to kind of ready to be the future challenges. We can share about story, how the family stick together through good times and bad. It also help the kids to learn that, we are connected with each other. There's something bigger, larger than themselves. Like there's this support system exists. Yeah, as a parents, we can be supportive. We like secure attachment, right? So you say that children develop coping skills within a context of safe environment. They need to feel safe so that they can go out and explore the world. They need to feel safe, develop coping strategy. They need to feel safe to problem solve. Emotional isolation, not feeling connected, is only going to make things worse. It narrow the options, people see that, I only have this option, how to deal with things. When they are alone, they think that this is the end of the world. So we all are social beings, and we want to know that, when we have problem, we have someone to count on. The same goes to our kids. When they have issues in school, when they have problem with their friends, they want to know that the adults are here to help them, even though a lot of times actually they push us away. So it's quite normal, like for teenager, adolescent, they want to have more privacy. It's like this desire for more privacy actually a natural part of growing up. And when they want to develop their independence or their new social interests, just like their new social role. So we could actually give them some time, but at the same time also set some ground rules and to make sure we know what's going on with their life, not that we just leave them alone. And if they prefer to keep them to themselves, keep things to themselves, we may let them know that we are available for here, we are available for them whenever they need. In the meantime, we also want to monitor. If they're not coping emotionally, we can actually proactively check in with them. There was this case that a while ago, I worked with adolescent and the mother. So the adolescent come in, suffer from depression, and it's like what Dr. Irie mentioned earlier, there's a lot of externalization behavior, like pushing the mother away, throwing tantrum, shouting at the mom. So the mom didn't know how to really help the daughter. And because what she senses is my daughter is always angry with me, is always upset with me. And even with like little tiny things like buying the wrong things, saying the wrong words. Yeah, so we can imagine the stress the mom is undergoing. And when I check in with the adolescent, she said she actually feels so bad for latching out on the mom, but she can't control it. It's that she's not coping well. So it's like something so full that it just overflow, and then it's not really directed to the mother, but mom got it. And she told me that she actually yearned for the mom attention and care, but had been sending the wrong message. You see, sending the wrong attachment cues. So instead of pulling the mom closer to her, she pushed her away. So in this case, it's push the mom do not give up. She doesn't give up, then she continue actively to check in on her daughter. Yeah. So we also want to help the child to build on self-compassion. Compassion would be very helpful for the children to deal with disappointment, failures, or mistake by being kind to themselves. In turn, it helps them to move on from difficult experiences. We want to encourage them to be active, to find something that works for them. Like what Dr. Erin said, besides distraction, we can also kind of help them to develop other coping strategies that would be helpful for them, like doing exercise, going for a walk, listening to music, going out as a family, doing something that can actually help them develop some healthy coping strategies so they won't turn to, the unhealthy one, like addiction, smoking, and playing games, and let's see. So a lot of parents also ask us, like, so how do we check in with our child? We don't really know how to talk to them sometimes. And it could be quite difficult that they just want to do with their things, especially nowadays with the handphone, they don't even look at us anymore. So we can actually start from checking in with them from something simple, like when we are driving them home, we can ask them, oh, how was your day? Just really to check in without really wanting to give more advices, really to just practice active listening, to hear about what's going on with their life, be curious, don't assume first, just ask more questions to know a bit more. Oh, nowadays it's like that. Last time, mommy time, so you can have some something to relate to each other. And it will help them to feel that, oh, my mom noticed me. My mom actually curious to know more about me, my life. And it will help them to slowly open up. And like what mentioned earlier part, validation is very important. We should focus on validating their feelings, rather than offering solution to them. Sometimes it's easier for women to do it because, when we hang out together, we gossip, and then we can help to validate each other feeling and saying, oh, yeah, that one I know, I also like that, my boss also like that. So it helps us to feel that these feelings are actually normal. When I in this situation, I feel so, it's actually normal. So how can we do it with our children? And why validation is so important? Because it's help them to assure them, right? All these feelings, thoughts, and internal experiences are all valid. It is actually one of the very important parenting skills. So during early childhood, parents validate from secure attachment, emotional connection with the children. When their children are allowed to express their strong emotion like disappointment, anger, disgust, fear even, they develop a sense of security. They know that I can turn to this adult to talk about things like that. I will be accepted. I'm allowed to feel so. So they feel comfortable being open and honest with them. And they also learn to, develop self-compassion, knowing that, oh, this is okay to feel so. And I'm okay that my mom would help me with this. And validated children, they learn about their emotional, all these experiences, right? They can also learn to regulate with the help of their parents. Effective validation could be quite tricky to carry out. And oftentimes we tend to use all what we learn from our parents, and very easy we will also fall into our old habits. Maybe we'll say something like, I don't worry, like just a test, or we'll say, what is this so scary about? I don't feel it's scary. Don't feel scared, don't feel scared, don't be sad, don't be sad. And it actually helps to invalidate them, because they will think that, I'm having this feeling and it's wrong, and I should not be feeling this. But we can't really stop how do we feel about things, you see. So there are a few steps that we can actually help to validate their child negative feelings, even though we don't agree with them, even though we think that such a small matter also make a big fuss. But we can actually help them to validate the experience for them without agreeing to that. So we can start from like noticing it. We don't try not to ignore them, because sometimes we are not so comfortable with dealing all these negative feelings. And we tend to just pretend we don't see, hopefully it will go away. But actually, these are all very good opportunity when we notice that our kids are not doing so well. We can approach them and just want to confirm that, like verify that, oh, I noticed that you have a very frustrating call with your friends earlier, if it's with an older adult, with other child, or you can, if you see that two kids are fighting, quite usual scene, and say, oh, I noticed that sister doesn't want to share the toys with you and you were crying. Or you can be like, I heard daddy say that you have a very bad day in school. Just from noticing, it helps them to let the child know that we notice you, we see you having all these difficulties, and we want to, understand more. We are curious about it. We want to help you with that. So the next step, we can acknowledge it we can say that before that, maybe if for a child that is able to speak, we can listen to them, see what they can anything to say about what's going on, and help us to understand a bit more about the situations. So we can help them to identify where does all this feeling coming from. And then we can acknowledge by saying, oh, you feel very unfair, right? That your sister doesn't want to share toys with you. Or you might be so upset that your friends say that, no wonder you're so upset. I can see why are you are so upset about something. Yeah, so by acknowledging it, we let them know that, oh yeah, this is quite true, that it's a very valid feelings that you're having, and it's quite normal. So that's how we normalize and validate for them. And the third step is help them to embrace it. It is a very crucial step, and it's actually a lot of us actually need more practice with it, because at this point of time, after we notice it, we acknowledge it acknowledge them, right? We will want to help the child to see it from different perspectives. We want to give some lecture. We want to say about, oh, instead of doing this, you should do what and what. But actually, at that point of time, the kids still try to digest with the feelings. They still trying to make sense of what all this about. And at that point of time, if we explain to them and we tell them what's the better way to do it, alternative way to do it, they wouldn't be able to absorb it. They were still in that mode of, emotionally still trying to regulate their feelings. So at this point of time, we can actually just be there, stand alongside with them, simply stay with them, give them a hug, or let them to have some time to let the feelings sink in, and then to help them to digest that. And then if we want to talk about, how to do things differently, we can talk about it later, when they are more calm, when they are more ready, and they have the capacity to take in more information, then only we do it. Yeah, calm strategy is what Dr. Ari mentioned earlier. And why is it validation so important? Because emotional dismissals can actually contribute to difficulty in emotion regulation. It's just like a lot of cases that we see in the clinic. A lot of times the kids are being dismissed, are being invalidated during their childhood. And the good thing is also we should learn to spot the early sign. So like early sign of depression and anxiety, so that we can know that we can quickly render help and give them more support or gather more resources to help our kids. Like they're having low mood, low energy, they're sending or posting moody messages on social media, Instagram, and talk about dying, death, hopelessness, on social media, saying some subtle remarks like, what's the point of this? What's the point of going for exam? I won't be around anymore when I got the result. Yeah, so these are quite worrying. And or to tell you something that you notice that they have this persistent worry about something, or they're worsening in functioning, like there's an unusual dip in functioning at school. They used to be very proactive in submitting their homework, but suddenly they just lose their interest of doing that, or they have difficulty performing something quite familiar, but they stop. They are not able to do it anymore. And sometimes it's manifested in frequent emotional or anger outbursts. And even more serious warning signs, like they started to cause harm to self or others, or they struggle with self-care, they stop showering, they stop eating, not sleeping, stop grooming. So these are the signs that really say that the kids need more support. So what we can do is we sit down with the kids and try to understand more from them, hear from them and tell them that, oh, mommy is worried. Notice that you're a bit different. Is there anything that you are bothering you that I'm not aware of? Always start from a conversation. It will help us to understand better from the child's point of view. And also when it's time that you think that you will need more support, don't be afraid to reach out for help. There are a lot of services, there are a lot of resources available. For example, school counselor. Our kids spend so much time in school, and there might be some school's counselor or teacher that your kids can trust. So if the kids are okay, reach out to the school counselor, find out more from them. What's something that's bothering them? And is there something that we can help? Work together with the school counselor to help them so they are okay. So or if they need more support, then what we can do. Yeah. Family Service Center is a community-based social service. They are located in community in the neighborhood. It serves individuals and families who need social and emotional support. Social work practitioners like social worker at the FSC provide case management support on family, parenting, financial, and other social issues. They are also partner with other agencies when it's needed, like school, hospital, ministry. And to find out more about the nearest FSC in your neighborhood, you can just Google FSCE locator, key in your postal code, and then it will link you to the nearest FSC. And you can either walk in, call them, or email them for help. And they will be able to help to refer to appropriate children youth services. And sometimes when a young person is having issues, having problems, it got a lot to do also with what's happening in the family. You know, mommy, daddy might not be in a good term. So the behavior might be then manifested at home, but not in school. School say he's okay, but when he's at home, he's crying more, he's shouting more. So sometimes the parents will also shut out from the kids and say that I don't want to handle this. I'm so busy with work. I got my own issue to deal with. So what the kids got there is that they're indirectly being shut out as well. So it's important also sometimes for the parents to reach out for themselves, to work with some social worker, counselor in the Family Service Center to help themselves so that we can also help our kids. If let's say the school counselor or FMC social worker say that there's some indication, it's really a lot more to handle and you should see a doctor, you can always start from the polyclinic, and there are health and mind clinic to help in the West to help with adolescents. And there are a lot of ongoing efforts by school or by different organizations or university students. They come together to develop some really helpful mental health kits, and it comprised with a lot of information about mental health services or how can we do to help someone with mental health issues. And like this one that I come across, you can just Google SOS Dare to Share. Then you will be able to access to this mental health e-kit that developed by a few university students. And there are some services available, like Shine Children and Youth Services. They have this program called Resilience, which is a community-based youth mental health program for youth 12 to 25 years old, located in Clementi. Yeah. And like helplines, like Tinker Friend Helpline by Singapore Children's Society for younger kids, or older kids like Limitless Helpline, 12 to 25 years old. It's all quite accessible. Just Google and you can find it on their website. You can access for help. Yeah, these are just a few examples, and there are a lot more services available. Yeah, that's all for my sharing.